Welcome to the Interprofessional Education for Enhanced Geriatrics Care curricular activity. This video will help you understand what to expect during the Clinical Immersion event at the College of Medicine's Clinical Learning Center, also known as the CLC. Students will be assigned to one approximately 2-hour session. As the event date nears, an announcement will be posted notifying you that the student's schedule has been posted on your course site so that you can confirm the time of your session placement. Make sure you complete pre-event online assignments and familiarize yourself with the preparatory materials, which include instructions for day of the event and standardized tools that you will be asked to use in the simulated patient encounter. We also recommend practicing use of these assessment tools. You will be working with a team of students from different disciplines to practice assessment of an older adult patient. For this activity, you will not be working with real patients. You will be working with standardized or simulated patients, also known as SPs, who are living individuals trained to portray a patient with a specific condition in a realistic, standardized, and repeatable way. Students should wear professional attire that aligns with community norms for healthcare professionals. Examples of these norms in Tallahassee are no jeans, sheer or see-through fabrics, no strapless or low-necked or midriff-bearing clothes, shorts, sweatpants, hats, or casual sandals are not allowed either. Students should dress in professional attire based on standards recommended by their respective colleges. Please wear your school-issued name tag if you have one. If you do not, we have name tags for you to fill out upon arrival. Please arrive at least 15 minutes earlier than your scheduled time block to allow time to find parking and get signed in. We recommend parking in the Spirit Way garage. Please do not try to park in spaces in front or behind the College of Medicine. Non-FSU students should check on your course website and ask your instructor for more specific information regarding parking. This is the front main entrance of the College of Medicine at Florida State. You will enter here and follow the signs to room G122 for check-in. Here's a map showing how to get to the main building entrance from the Spirit Way garage. As you walk through the front door, stay to the right and take the very last elevator on your left down to the lower level. Once you enter the elevator, press the LL button. Once you exit the elevator, room G122 is where you will check in. Once you have checked in at G122, on your left is the entrance to the Clinical Learning Center. You will meet with your team in this area during the pre-brief before the encounter. The Clinical Learning Center is a simulated environment with exam rooms to portray a clinical setting. The encounter with the standardized patient and interprofessional student teams will take place in the exam rooms. Upon check-in, where you will be assigned a team number that corresponds to the exam room you will be in, students will meet briefly with their team for approximately 20 minutes to discuss team formation, delegate roles, such as who will be administering what screening tools, and establish expectations and goals for the encounter with the standardized patient. Once it is time to begin the 25-minute patient encounter, you will wait at the blue line in front of your assigned exam room until you hear a doorbell announcement to enter the room and begin the encounter. Once you hear the doorbell with "Begin Encounter," like this,
Begin encounter.
enter the exam room. Now, here we will demonstrate the standardized patient encounter. Each team member needs to properly introduce themselves to the standardized patient. This is the wrong way to introduce yourself.
Let's go. Hi, I'm the doctor. My name is Dr. Niharika Sucha.
Okay.
And this is my team. And I think we should get down to business.
Okay.
So I have some questions.
This is the right way to introduce yourself.
Come in.
Hello, Mr. Rossi. How are you?
I'm okay. How are you?
Good. I'm Jean Munn. I'm a social worker.
All right. Good to meet you, Jean.
Good morning. I'm Angela. I'm a pharmacist.
Angela, good to meet you too.
Hi, I'm Maria. I'm a nurse.
Maria, good to meet you.
I'm Niharika Suchak, a physician.
All right, Doc, good to meet you.
During the encounter, if you are not speaking directly with the patient, be mindful of your actions. They can be interpreted as nonverbals to a patient that you are distracted or unengaged. These behaviors are distracting to the patient. They are not professional, and they do not add value to the patient encounter. Practicing the screening tools prior to the event is essential to successful patient encounter. These tools will help you assess the patient's daily function and mental health.
All right, Mr. Rossi, I have a few questions for you regarding the way you've been feeling recently. These are about your mood, and we're talking about the last 2 weeks. The options that you can give me are not at all, several days, more than half the days.
We will not include all the tools for this video demonstration, but please practice them as described in your syllabus and modules. Practice with classmates, friends, or even in front of the mirror to be prepared to use them in the encounter. To help you gauge how much time you have left in the exam room, a 5-minute warning announcement will be played. After you have completed the assessment and interview of the patient, you need to conclude the encounter with a brief message and farewell. This is not how to leave the encounter exam room.
And before you leave,
I have to leave.
I'm sorry, I don't know what happened.
Here is the correct way.
Thank you, Mr. Rossi. I've enjoyed spending some time with you,
Thank you.
and we're going to work together to give you the best possible care.
I appreciate that. Thank you.
Thank you, Mr. Rossi.
You're welcome. Thank you.
Thank you. Have a good day.
You too. Thank you.
Thank you.
Thank you, sir.
Thank you, Doc.
We'll work together.
Appreciate it.
After you finish with your standardized patient and your interprofessional team, follow signs and staff to the classrooms to complete the post-encounter survey and debrief discussion with interprofessional faculty. Once you arrive to the classroom, you will sit with your team and have approximately 10 minutes to informally discuss the encounter with your teammates. This information exchange with your group is designed to improve team performance and effectiveness as an after-action review. You can discuss points of improvement, potential treatment plan recommendations, how your discipline may have approached a task differently, or any other general feedback you may want to discuss with your teammates. You will also begin your post-encounter survey on the laptops in the classroom. If you are a medical student, please bring your laptop with you. You may also choose to use your smartphone or tablet to complete the survey. The final part of the day is a faculty-led debrief discussion, which aims to encourage students to discuss how they felt working as a team, perspectives they may not have considered before, and overall feedback of the encounter. Thank you for watching this video, and remember to prepare for the event. Look on your course site and check your email as the interprofessional event approaches, as this is where the schedule and additional announcements will be posted. Thank you.